So in this video, I'm going to very briefly discuss nerve gliding for cubital tunnel syndrome. So the normal action of the elbow, being like flexion extension that you would do throughout the day without really thinking about it, well, the nerve naturally moves and it can move by up to 1 centimetre. And that is the natural or normal gliding of the nerve. When you develop something like compression of the ulnar nerve at the elbow or cubital tunnel syndrome, the nerve and the surrounding tissue can become a little bit inflamed. You can begin to develop fibrotic tissue, and essentially it can reduce the natural movement of the nerve. So the nerve gliding exercise is just to try to encourage the nerve to glide through its normal movement. It should also be said at this point that the nerve gliding exercises for cubital tunnel syndrome, similar to for carpal tunnel syndrome, have limited evidence behind them. And if you have cubital tunnel syndrome and you want to try them and it makes your symptoms in any way worse, then you shouldn't do them. And if it doesn't make any positive difference to your symptoms, then there really isn't any point in doing them. So I'm going to just quickly show one of the nerve gliding exercises, but when we do some more of the exercise videos, we can go through that in a little bit more detail. So you'll be holding the arm in 5 different positions. When you're doing the exercises, each position should be held for 5 seconds and then repeat them all 3 to 5 times. So essentially, I'm not sure if it'll come out great here, but you're holding your arm out with your palm facing up. Then you bend your elbow so your palm is facing towards you. Then you rotate your hand so your fingers are pointing back towards you. And then you rotate your hand again so that your fingers are pointing more downwards. I'm not sure if that's showing there. And then you extend out your hand, I've gone off the camera now, with your hand down like that. And you essentially just hold each one for 5 seconds. I know it's kind of difficult to see them there, but that was just more to give an example of what they look like. But again, they're the type of exercise that you can try and you can see if it works for you. But if it makes the symptoms worse, then you should not do it. And if it doesn't make them any better, then there is no value to doing them.